Charlene, are you already recording this? I just hit record, but okay. And you're letting people in. Okay. Hello, everyone, and welcome to the June System of Care Advisory Council Learning Collaborative meeting. We are joined today by the team from the University of Connecticut's Systems of Care Institute. Is that what you're called? I'm sorry if I got your name wrong. They can introduce themselves correctly in a moment. And this is our last Learning Collaborative space with Denise and Kim. We are going to be talking about continuous quality improvement. And I've got your PowerPoint up. Do you want me to share it, or would you prefer to?
Can I share it?
You sure can. Let me make you a code.
We have some animations that make it easier or less of a burden on you. Let's put it that way.
Make host. There we go. Now are you seeing the share screen button, Kim?
Yes.
Okay.
Are we ready?
Yeah, do you want to start with introductions, or do you want to hop into it?
Absolutely. Denise, do you want to go first, and then I'll jump in and share my screen and introduce myself all in one?
That sounds great. So Denise Sulzbach, she, her pronouns, happy to join you again. We are both at the Innovations Institute. You're very close, Anna, at the University of Connecticut, UConn School of Social Work. And we don't have Dr. Tony Bonadio with us today. He is actually also an active clinician, and he had a family this evening whose appointment should not have been moved, even for all of you. So you're stuck with Kim and me. And then Johanna's also traveling today. So again, you're stuck with Kim and me. And we're going to jump in and talk about some data. So Kim.
Yes, hi. Good afternoon, everyone. My name is Kim Estep, she, her pronouns. And I'm the Director for System Design and Implementation Strategies at Innovations. And if I forget to say later, I just want to say right now that Denise and I have really enjoyed partnering with you over this past year. And so thank you for giving us the opportunity. I'm going to share my screen, and let's hope this all goes well.
It will. Kim beat me to it. We're also talking about something data-driven decision-making, which the two of us geek out about it. So you don't get a researcher or evaluator, but you get two system gals who are really like to geek out about data. So share the love with us.
Yes, so true. And as we go through, if questions come up, just raise your hand, pop it into the chat. And I'm assuming Denise and Anna and Christy, you can help with the chat because I can't see it really, and present at the same time and have all the screens going at the same time. So let's jump right in. So today, just a quick overview of the agenda. We're going to talk about the purpose and just kind of general framework of using continuous quality improvement to support implementation or reform or strategic planning or whatever you might have going on at the state or local space. We're also going to talk about the current barrier process and how that can be integrated into those quality improvement cycles. Also talking about the use of CQI processes to address disparities or any questions related to equity. And then talk about how do we pull in other data sources and where do we find them and so on. So we're going to give you a few examples of those today that we can use to answer those CQI questions. And then we're also going to pull in to discuss and learn from the SOCAP data report and the wonderful data that is in that. Denise, did you want to add anything before we kick it off?
Well, should we give props to Christy now? Because we're going to be tagging her for that data report.
Yeah, Yes, so you get to hear from your local folks around that data report. So here we go.
We're going to do hope to do some breakout group exercises with y'all at the very end.
Yes. Yes, we're not going to talk at you for very long. So just, so you have something to look forward to in this, that you're going to go and talk amongst yourselves and with your peers. So we're going to just do a real quick review for those that may have missed Tony's presentation, or, just a reminder, a refresher. I know I need that on a daily basis. So continuous quality improvement is just using teams and data to assess, to plan, and to improve, right? We want to know how things are going. Are things working? Are we doing the things that we set out to do, and so on? And so in that CQI practice, just really high level, we know we need some sort of team. We need a CQI team, implementation team, whatever you want to call yourselves, your local system of care teams. But we need those group of folks from, different child serving systems and agencies and communities, and of course, parents and youth. A CQI plan, and of course, data, right? I mean, if we're going to talk about CQI, we kind of have to talk about data. So CQI in practice, and it's really this kind of cycle of meeting with the team, asking a question, looking at data, making a plan, and tracking progress. And we just do that over and over and over again. And actually, this has a name. It's called a Plan, Do, Check, Act, which I'm going to talk about in a minute. So we're going to focus today, though, and from the last session, we talked about asking questions, like what are the questions that come up, and how does that drive how we look at data? And so we're going to group those two together for you today. And but first, I just want to explain this idea of plan, do, check, act cycles, which I'm not going to get into a lot of like terms and all these things, but I really think that this is an important distinction for systems to make, because I think what we're familiar with is this PDSA, right? This plan, do, study, act, where we want to know if the things that we've done, did it matter? Did we make a difference? And we're actually studying the impact of change. Those data are typically available quarterly, maybe semi-annually, annually, but it's not usually in a manner that allows us to have the data in a timely fashion and be able to use that to make decisions related to priorities of a strategic plan, related to change efforts, transformation, implementation projects, and so on. So I want to make a distinction between that PDSA cycle and what we call a PDCA cycle, which is a plan, do, check, act. I talked to Denise this morning. I was like, oh, I hope my words work today. Clearly, I'm going to struggle with that for a little bit, but plan, do, check, act. And this is a way for us to check in around the implementation. It's rapid cycle, meaning that we're looking at it, we're deciding what our questions are, what our data source is going to be, and we're going to check in on a regular basis. It could be weekly, it could be bi-weekly, it could be monthly, but it's more rapid than that kind of study space, right? That then we're going to use that data to inform decision making and make any changes. And that is so, so crucial. If the data aren't trending in the way that you would like to see it, then what do we need to change? And we need to do this more often than kind of an annual approach or something like that. And it's not that there won't be barriers that we might need to address. We need to talk about it, but thinking about using that data to drive decisions, that rapid cycle reporting, which is that check, we're going to do quick checks. And so we're going to, give some examples. And I think that that'll make, start to make a little more sense.
And then Kim, before you go off this slide. So the SOCAG data report is a great example of the Plan Do Study Act. It's an annual report on overall data. What we're going to do in our exercise today is those studies that come out of Plan Do Study Act processes are actually data that you can use in your decision making through a Plan Do Check Act process. And so that's what we're going to do today. And an example of the Plan Do Check Act process that we're going to talk about is also you could use data to help prioritize strategies or your barriers in addressing and identifying strategies to work them out.
Yeah. And also in that Plan Do Check Act could be the system of care dashboards. You could, go in and look real quickly at the data point or the questions that you're curious about. And that's also another way to get some information to drive those decisions. So we want to talk about using the barrier process to identify questions. So thinking about what are the barriers that come up frequently, and what barriers are impacted by a lot of young people and families, or impacting many of them, I'm sorry. And while we do want to look at those barriers that are impacting many families, we also need to make sure that we're drilling down to look at disparities, because the numbers could be lower if they're not able to access care. And I want us to think about, how do we check in and look at not only who gets in or gets the thing or accesses the service, but making sure that we're looking at who did not get it, who didn't get in, who might have not, but wasn't eligible, because that's a space that you're gonna really see highlighted some of those disparities in access and care and so on. Denise, did you want to add anything before we go to the examples?
Let's keep on going.
Okay. So everyone get your chat ready, or get ready to unmute yourself, because we're going to walk through a little bit of back and forth here. So we're going to show you a barrier, and then we want to see if you have questions and what are some example CQI questions that you all can come up with. So again, either unmute yourself or pop it into the chat. And our first barrier example that we're going to look at is school-based services for youth and their caregivers. Oh, by the way, this was pulled from the barrier report,
From June to July, I'm sorry, January to June 2023. So these are your barriers.
Yes. We didn't make them up, we just pulled them from that. So school-based services for youth and their caregivers are often siloed in the education system, and school staff don't have knowledge of the larger system and are sometimes unsure about how to connect students to existing services. So go ahead, pop a question in the chat, or unmute yourself, whichever way you prefer. But what do you think an example CQI question might be if this is your barrier? What comes to mind? What do you need to know to be able to make a decision or impact this in some way? And Denise, I might need your help, and I might need your help with the chat.
I would want to know if this is a statewide problem, or if this is specific to specific districts or specific schools. Yeah, so Mandy's question in the chat, how many school systems are affected by this problem?
Yeah, absolutely. Absolutely. Good question. So already thinking about drilling down, is this systemic? Is it just our community? Are there peers? Those kinds of things. Anything else?
Chris, which age group is affected? What age group?
Absolutely. Absolutely. And that's really important too. Okay, so here are some questions that we came up with, but certainly the questions that you came up with are great too. It just depends on your perspective and the jurisdiction and so on. So how many youth are receiving school-based services and also receiving services from behavioral health? And again, just an example to add to all the ones that you put in. Was there anything else, Denise, or can I go to the next one?
No, I just want to make sure that Selby is able to get on. I think the hosts are.
I let her in. I was not a host for some reason, but I just
Okay.
reclaimed it and let her in.
Okay.
Excellent. Didn't want to make sure we weren't barring Selby's participation.
Okay, next example barrier. Again, get that chat ready or unmute yourself. So the IDD approval process and services provided, once an approval is made, is very limited. ABA services are contracted outside of the county and only directed for youth who, you know, are very low functioning in their daily activities. So what are potential questions that come to mind related to this barrier?
Which counties are affected? Yep. Mandy, thank you.
Absolutely. What else?
What services are available? Like if the services don't exist, I feel like we're looking at a different solution than if people just can't get access to the services that exist in their community.
Yeah.
Yeah, so
Absolutely.
Danny put how many ABA contractors are available in this area?
Perfect.
Absolutely.
Kathleen, what are the limitations around services?
Yeah.
Is this directed at youth transitioning into adulthood or all through the school years?
And Mandy
age-
put which counties are affected?
Mhm.
Absolutely. See, you all are doing so good. So here are the questions we came up with, which also overlap. How many young people are seeking these assessments? How long does it take for young people and families to complete those assessments? What is our county's current capacity to provide services and supports? Yeah, you all are right on. So one more, we're gonna try one more and then keep going with the examples. So in this barrier, very little quality language access nor culturally responsive or aware. I feel like this is one of those moments where there should have been a comma somewhere. And I didn't say that right. So quality language access, culturally responsive and aware services. It happens over 70% of the time and affects families because they aren't able to access or receive services they need. To maintain a healthy parent-child dynamic, navigate systems, and so on. So what do you think your questions might be related to language and access, culturally responsive and aware services and supports?
Mandy says, what language access exists? How many families and in which areas?
Great.
Absolutely. Absolutely. See, you all are getting so good at this now, it's just rolling right along. So how many families do we serve for whom English is not their primary language? What languages are spoken? How many service providers do we have that can accommodate non-English speakers? And again, these are just examples. But
We have
that's, go
some
ahead.
more in the chat.
Oh,
What
great.
cultural groups are affected? What languages are needed? What culturally responsive and aware services are desired? Great.
Absolutely. Great questions. So then we're going to try and connect priorities and the barriers to really start to drill down on the direction of our questions. And so thinking about what are our local priorities, what issues are we seeing through the barrier process, and do any of the issues that have been identified through the barrier process align with our strategic priorities, be it the state or local or so on. And so that's really what we're looking for. And priorities can help narrow the scope of the questions or information needs and so on. So thinking about, do we have a strategic plan? Key priorities for our local system of care? Are there specific populations that we need to focus on? And then again, getting back to that equity lens, issues related to equity. You know, what's in your plan? What are you most focused on within your local system of care? And so Selby was kind enough to provide an example for Tri-County. So they're, and and Selby, certainly jump in if I get this wrong or mess these up. But they have developed priority questions, you know, connected to their system of care agenda that are driven by those system reform support instrument indicators of a good and modern system. And so some of the examples are, will addressing this barrier help to keep young people at home and with their families, and avoid, you know, placement or removal? Will addressing the barrier impact the population of focus that they've defined for their local system of care? And number 3, will addressing the barrier reduce the disproportionate impact of out-of-home placements on Black, Brown, and Indigenous youth? And so you can see in some of these examples, you can start to align barriers with your priorities and really narrow your questions and your scope of the data needs. And then additional questions that might be connected to strategic priorities is, does the barrier delay action where an immediate or urgent response is needed? And does the barrier contribute to a fail first approach, meaning that families have to try one thing first, even though it doesn't quite meet their needs? That has to not work, and then they can access, you know, that next step or something that might more closely align with their needs, and so on. Denise, did you want to add anything, or Selby, did you want to?
I'm interested in seeing if Selby wants to, and I believe Selby shared these questions with some of you already. Others are interested in using them. And this is why I really was concerned and glad to hear that Selby got in the room. Selby, do you have anything to add?
I think the only thing I might add is that for our local process, we've just tested these out one time so far. So as of yet, there's some flexibility in how we approach the questions. Like, we haven't made a strict numerical cutoff of the barrier must get a, you know, must answer yes to, you know, 6 of the 8 questions or something like that. So there's some flexibility. And then what we did with this is we actually send the barriers and these questions out in the form of a survey prior to the meeting, and people are supposed to answer them at home. And so we come to the meeting with an initial glance of a pie chart, if you will, where we can see how each question got answered and kind of where committee, what direction committee opinion is trending. So it's been interesting to see, like, how the opinions sometimes, as you can imagine, they're all right on point, and other times they're very disparate. So that's part of the process of working through it as well.
Great, thank you for
So
sharing.
Selby, these are all appear to be systemic questions to get to the root of systemic issues. Do you have a process that differentiates between a barrier that's been raised that is really child and family team specific that can be resolved at that level of your barrier process versus something that needs to be considered for larger tri-county efforts and then possibly SOCAC support too?
I want to say, yes, some of you may have heard me talk about what we're calling our resolution pathways. And one of those pathways is a practice level work group pathway. And again, some of you might have seen, we created we have like a chart that has different characteristics of a barrier, such as maybe how long it takes to resolve, how many systems are involved, level of funding needed, level of leadership needed. And we created criteria for each of the resolution pathways based on those different characteristics. So the level of leadership may be needed to work on a practice level problem might be different than the level of leadership needed to work on, statewide systemic barrier. So I think that's kind of what you're referring to, Denise, if we identified
Yeah.
ways we can move the questions down move the barriers down different channels. And we also created conditions about a barrier we wouldn't address or review as well. For example, it comes from the adult system, or it's just kind of opinion based. So we have those kind of barriers, those kind of, boundaries set up
Right.
as well.
And so then these boundaries and these channels that you've developed, they in them themselves then collect data that can be used to inform decision making on behalf of your. It seems like every time you create a process, then you're also creating some data that's useful for your ongoing system of care development. This is a little bit of teaser, folks. While Anna said this is the last time you'll see us in this space, we are joining tomorrow's barrier meeting, where we're going to delve even deeper into the barrier process. And that's a continuation of the discussion we had in April. So hopefully we're going to put another plug, but I'm putting it in now. Hopefully many of you would join us tomorrow as well. Thanks, Sally.
Yes, thank you. And so, you know, again, just high level, some available data to answer this question. You might be able to go to the SOCAC dashboard, the Oregon Department of Education. You may be able to look at census data, but really not only narrowing your questions, but also what are your data sources? Because we don't need to get lost in data. We need to, you know, be specific and targeted in our data, and know that we still have to move. Like there is a sense of urgency because there's families and young people on the other side. Even if it's not at that child and family team level, if it needs to rise up and it's a broader issue, you know, there's still a sense of urgency around that. So let's walk through a quick example. Okay. So we're going to walk through aligning barriers and priorities. So again, this barrier is that the IDD approval process and services provided once an approval is made is pretty limited, that ABA services are contracted outside of the county and directed for young people, you know, with very low functioning scores. And so thinking about if we're sticking with that Tri-County example and some of the questions that they have related to priorities, right? So is it going to impact the population of focus? Is it going to delay action when there's a need to immediately improve or ease the situation? And is this contributing to a fail first approach? So those are just a few, right, that we could strategic kind of questions that we could pull out to align with this barrier. And then asking the important questions, like how many young people with IDD are we serving in our region? On average, how long does it take for a young person to get an assessment following their referral or initial contact?
Yes.
Go ahead.
Yeah, just need to keep clicking because
Oh, I'm behind in my clicking. I'm so sorry. I'm one behind. What is the capacity for assessing young people with developmental disabilities? What is the wait time for the assessment, and does it vary by race or ethnicity? And so it's really important that we're disaggregating the data by race and ethnicity, gender, other, you know, factors that are critical based on our questions and so on. Does wait time, I'm sorry, do we have the capacity to conduct these assessments for non-English speakers? And how might our policies impact wait times? So we're not only looking at the provider, you know, level or family level, but also our policies or statewide policies around access and, you know, service provision and so on. We need to kind of check it all. So what data sources are available? So we have the SOCAC dashboard. We also have a data page with child and family surveys and so on. And then the data on the dashboard, again, Tony got this right in the first one, and I'm like, oh,
Multnomah.
Multnomah. I was close. I mashed it up a little much, too much. But again, thank you for letting us pick on your county. But you see here the youth served, right? And then this kind of crossover with youth served in IDD and also in behavioral health, child welfare, juvenile justice. So this again is one space where we're pulling the data in. And then
And
once
as we're looking, I'm
Oh,
sorry,
go
Kim,
ahead.
just as we're looking at each of these responses or what we dig up in response to our data questions, we're using this data then again, drive decision-making, help us determine strategies that we can put in place in order to address the identified barrier.
And so other data, we, can ask, does wait time vary for the assessment by race or ethnicity? And so we see this, our breakdown here. And then what do the data show? So do we have the capacity to conduct these assessments for non-English speakers? Do we have non-English speaking families seeking IDD services? And so here we have language spoken at home, getting information about services and supports in our preferred language. And so then we can check in, right? So you can see that we're starting to drill down into, making decisions by fact rather than feeling. Like if we feel like this is happening, are we verifying that and making sure, that we're addressing the problem that we have. And so then what data do we still need? We need numbers of families seeking assessments, length of time, families are waiting for assessment, providers who are conducting these assessments, can they conduct them in any language other than English? And what are those policies that are governing those assessments? And so our key takeaways is that the numbers of families being served are, it seems that that's been increasing. There doesn't seem to be disproportionality in the number of young people who identify as non-white being served. Data is still needed though on wait times and availability of services. And are these data being collected and who might hold them? And so I'm going to pause here for just a second, again, to remind folks that don't let the lack of data hold you back from finding a solution. And how do you know when you have enough data to make a data-informed decision? And so you're trying to balance the need for data-driven decision-making and then that action, that taking action. And I know this is a passion for several folks on the call who are like, oh, data, that we want to use it, but we also want to be very much supportive of families. Were there any questions before we move into, Christy's going to talk to us about the SOCAC data report really quickly. Any questions about that example or thoughts, comments before Christy talks to us about that?
You can just unmute or you can raise your little Zoom hand, whichever is more comfortable for you.
And if you have your settings set, you can just do this and Zoom will recognize it. I move too much to turn that setting on, so.
So
Selby says
Selby,
you make it look so easy. I've been struggling to get needed information from partners in my region that we need in order to set some equity targets around reducing out-of-home placements.
yeah.
Sure.
Asking the question is sometimes easier, Selby, than getting the answer.
It is true. It is true. It does start to help, at least for me anyway, and I don't know how you all feel about it, but thinking about these questions and being able to narrow it down makes the problem seem like, or the challenge seem like we can actually do something about it. Like we can find some information and do something about it and then track it. And so it doesn't feel as heavy or as big if, when we start to drill down to what are the information needs, what are the questions we have, and then we start to tease apart some of those big challenges.
But and to Selby's point, it's not easy. It's
No.
not easy. So we're
And-
grabbing what data we can find, what is available,
Yeah.
and then using data to then measure whether or not we are making a difference moving forward.
Absolutely. And don't give up, go look for it. So one of those places that you can look for it is in the SOCAC data report. So I'm
What's
gonna
that for a
turn this
transition?
over to, I know that worked out great. To Christy. Christy, do you need me to stop sharing or are you good? Like,
that's I can share it. That's awesome. I'm actually on my
Okay.
phone copying
Okay.
a file, very large file on my computer, and it slows everything down. So,
Mm.
yeah. So System of Care data report. This was a major accomplishment from the SOCAC Data Committee. We published this, I think, just early this year, January or February. The purpose of this report was to establish measures and data sources for the outcomes that have been identified in the System of Care strategic plan. So the strategic plan, I think it was released back in 2021, articulated 10 outcomes, that if we do all the things articulated in this plan, then we will know we are successful by these outcomes that we achieved. And they were very big, kind of ambitious statements, which were great, but they didn't have any data sources or measures. So on their own, there wasn't really any way to measure, well, how are we doing in our progress towards that intended outcome? So we brought that question to the data committee, and it took about a year of meetings, sometimes very painful meetings, to arrive at this report. What that looked like was modified some of those outcomes a little bit. We didn't really want to dig into the actual language. We really wanted to focus on what were the data sources and measures, but we did have to make some little adjustments, which are explained in the report. We also had to be using data that was already available, which there was a lot of conversation about that, just given the limitations of the data that we had to. And there's a lot of data that's available. And so that was another big challenge that, there was some dissatisfaction, right? Like, is this really the right measure for the outcome? No, not always. So the on page 3 or 4 of that report, it articulates the criteria that we use to make decisions about, well, what is the right data source? And you'll see it looks at things like, could the measure speak to concerns of equity? Is it being collected on a regular basis? We didn't want to look to just like a one-time study, but we wanted something that was being collected, annually, if not more frequently, so we could trend this data over time. We wanted to look for things that were already aligned, right? So we looked at things like CCO measures, or state agencies are reporting, key performance measures annually to the governor. So we wanted to look at things that, in the spirit of creating a shared data set, where were some of those measures already in place? We looked at data sources that were reliable and valid. That was the place, I think, where we had the most challenge, right? And that we had to make some sacrifices in the data that we were using. But this was the results. So we have the report. It is 11 outcomes now, with a data source for 10 of the 11 outcomes. One of the outcomes still has like a measure under development. We couldn't quite get to agreement. So that'll be an area of improvement moving forward. For the most part, all of the indicators are available at either the county or the CCO level. So that was the other kind of angle we were hoping to make this a relevant data source for our local system of care partners as well. So it's things that you can kind of use and look to for your own quality improvement and data work, right? Like, how does our region compare to the state, or, to our neighboring counties and regions? It also disaggregates by race and ethnicity at a minimum for most. Not all of the indicators have race and ethnicity data. And a couple of the measures have even further disaggregated data, particularly around sexual orientation, gender identity. Some of the education data has other priority populations that we were able to articulate as well. So, happy to answer questions about the report, or if there are examples that people want to share about how they've started to use this data in their local region, I would love to hear that. Moving forward, the hope is that we will update this data regularly, pending hiring of additional research staff. We would be hoping to make an update to this data, later this year, by end of the year. And we know that that there will be some revisions to the outcomes in our next strategic plan, and that process will all get started next year. So, it's a start. It's not perfect. There's a lot of limitations, and I think there's tremendous value in the way that this report communicates and articulates what the system of care is really trying to get to, right? There's so much misunderstanding about like, what is system of care and what are you really about and what are you really trying to get to? And I think the communication value of this report is really helpful in kind of providing a shared understanding of what we're trying to get to. So.
And just from a national perspective, if I could jump in, like, this is pretty fantastic that you all as a state are giving data back to local communities, and that there's a real targeted approach to children and families in that data collection, sharing, reporting, so on. We don't see that in I won't say any other state. It's very few though. I will say that. So it's
You that have two
pretty
things. One,
impressive.
I'm
Yeah.
sorry, I'm talking over you, Kim.
Oh, go ahead, Denise.
Two things. You actually have the data dashboard, and then you have a report that analyzes it and gives folks back. So that's fantastic. Kim, I actually spent time reading the report again. So it's nighttime here. My house is being renovated. My light strobes behind me. That's why I have this wonky lighting. The sun is setting, so forgive me the darkness I'm surrounded in right now. But can I share my screen, because I want to show
Sure.
just a couple of pages here that I thought help demonstrate the type of data you can find. So this aligns with our conversation this evening. Christy, I don't know why Black African American data is not reported. I don't know if you have information on that.
Oh, this indicator is coming from, I think it's the MISP survey, the mental health, no, MISP, or maybe it's the CAP survey. Anyways, it's a survey that goes to a subset of OHP members, and the response rate is low.
Okay.
Major limitation across many of these data sources, and so that is why it wasn't reported. They didn't have a substantial enough response for people who identified as Black.
To Kim's point earlier in wanting to look at who's not accessing services, right? When I was just looking at this chart and noticing, so this is the percent of families who got information they needed by race and ethnicity. It's your American Indian Alaskan Native and your Native Hawaiian Pacific Islanders down here that are falling behind the bar. So that would be a data question that we'd be looking at, like, why is that happening? And what I also love about this report, as Christy mentioned, in the bottom left-hand corner in most of these charts, there's a live link you can click on that can bring you some more county-specific data. There's some great data about some disparities for LGBTQ trans populations, and I'm queuing us up for our next discussion, guys, in the breakout group. But I'm going to scroll. Watch your eyes, because this other one really struck me. This one, percent of students who complete high school by subgroup. And so you have race, ethnicity up here, but then we get thrown in foster care and the houseless. And look at the foster care and how you're less than 50% of the kids actually graduating high school if you're in foster care. So then to Salvi's point of, I can't get data from my partners, that's a data grabber to get your child welfare partners at the table. Figure out the why. What can you do together as a system of care to address that indicator and turn that curve?
Yeah, especially when you can go and you can pull your county and district data below.
Yeah.
Yeah, it's very cool. Very helpful.
Yeah, the other thing I didn't mention, although this was really focused on the outcomes, at the end of that report, we do kind of a very initial, very high level analysis from the dashboard where we trend data since the beginning of the dashboard. And we break it down for behavioral health, IDD, juvenile justice, and child welfare involved, and also look at the trend of those involved in 3 or more systems, which is on the decline. So good news.
Good.
That trend.
Okay, so we are going to go into breakout rooms, but before we give you your questions and so on related to that, did you all have any questions or comments for us based on the example or the SOCAC report that was shared? Any questions or comments? Okay. I'm going to share my screen again.
Well, Christy, while Kim's bringing this up, based upon the number of people we have, how many breakout groups do you think we should be doing here?
If we put, I thought there were 4. Were there 4 rooms, or we're just doing a random breakout? Isn't that it?
I think we're going to do random breakout to what we
Yeah.
were going to judge it based upon how many people we have participating tonight.
Yeah. 5 or
today.
6.
Okay. So here's what we're gonna do. We are gonna practice again, a reminder around this CQIM practice. We're gonna ask a question, look at the data. So in your breakout rooms, we're gonna need someone to volunteer around their local experiences and share some priority areas so that you can kind of walk through this process together. So that volunteer, that group leader, if you will, is going to share their local priorities, or at least one. Right? And then on the ask a question front, like what questions do you have related to that priority? And then that look at data section, can you find data to support those priorities? How do the data adequately represent the experience of underrepresented or marginalized groups? And then we want you to give it a whirl and go to that SOCAC data report and see what you can find that can help guide the decision making related to the priority areas and any disparities that may be evident.
And so
Go ahead.
discussion, we're shifting away from, we spent some time today talking about barriers. We said, well, this is a teaser. We want you to come back tomorrow so we can dig in a little bit deeper about barriers. So this is just another way of using data and looking at data to help address priority issues in your system of care. So we're going at the back end. What are our current priorities as opposed to using the barriers to identify priorities?
Yeah. Thanks for adding that, Denise. I forgot. Yeah, we're moving on to another example. Okay. So however we get whisked away, I think if we put these into the chat, can people take them with them?
And we also want to put in the chat the link again to the report, so folks have that as well.
Yeah, I think you can still see it when you go into your breakout room. If not, chat me and we'll paste it back into a chat for you directly. And the link is right above where Kim just pasted the questions in. And again, if you need that link once you get into your breakout room, let me know and I will chat it to you directly. And you should be able to find it in your breakout room once you're there.
And I believe Kim's going to go in one, I'm going to go in one, Christy's going to go in one, and you're going to go in another. I lost you. We're jumping around here. Anna?
Yeah, I just stopped sharing. Sorry, so we could see each other.
Sure, I can go in one. I may not be able to get a chat then. So I was going to hang out in the main room for a second and make sure everybody had what they needed, and then I can hop into whichever room.
Why don't we give them a second to orient themselves, decide on who the group leader is, the priorities being shared, and then we can pop into the breakout rooms. Is that okay? If we give you all just a minute in the groups, and then we can pop in and see if there's any help that we can offer. Okay. So I don't know how this happens.
I'm looking at Christy's box,
I know.
really her phone.
Oh my God, I know.
Oh, I think Anna's gonna open
Oh,
the
am
room.
I supposed to be doing it? I'm sorry, I thought
Oh,
you were doing it.
sorry.
That's why it's not happening. Breakout rooms.
I know, I'm like, I don't have the option. I can't do it for you. I don't have the breakout room option.
Okay, so we're gonna be in 3 to 4 people in a room, so little small group conversations. And if you click, oh, I have to click enter. You should now be able to click join. There should be a blue button. And you should be whisked away to your randomly assigned breakout room. Looks like we may have some folks who have stepped away from their computers, but everybody who is active.
Denise, you were so still for a minute. I thought that
Oh,
you were
really?
frozen. It's like, where's-
No, we just don't have light.
It's actually okay. You have a light shining.
Is it?
Yeah, you
Mm.
actually look really nice. It's like you have portrait lighting on you.
Yeah.
Oh my gosh. Well, that's, I guess, an advantage of having a strobing ceiling fan.
Include that.
Thank you, Kim. Kathleen, did you ask for,
Hi,
I'm sorry, I wasn't ignoring you.
we did. We were wondering how much longer we were going to be in the room, and your message popped up. So
50 seconds.
no worries. You read our minds. You just didn't know it.
I was supposed to pull us out at 4:15, but we were having this really interesting conversation in my breakout. So we played that out for an extra minute before I closed it.
No worries.
That's nice. Poor Adam and Kathleen got me, and we didn't really, Kathleen helped like look at data and stuff, but I was like, oh, sorry guys, I'm not very versed in this. And I mean, we are trying to start working on data, but we're not there yet. So,
I mean, that's great though, Tracy, because like that is the point of these spaces. If you were excellent at it, you would be bored out of your mind being in this room.
yeah.
I was just going to tell Selby that she's going to be hearing from you.
I know, totally. I know. I'm like, I've heard of something.
Your name was mentioned, Selby.
Oh, sorry.
You know me, Tracy, always up for a conversation. That's the problem with me.
That's not a problem. That's why you are so loved. I so appreciate you.
And to that point, what we were talking about was Selby's sort of base questions, right, that help prioritize and set some barriers and boundaries around the barrier resolution process. And one of the questions that I really love that the Tri-County System of Care asks is this something that needs to sort of be solved urgently because we have a family in crisis? And if so, they sort of triage it over to their practice level work group space where there are clinical people who can work on that instead of having it walk its way up through this barrier process. It gives you a level of priority. And I think sometimes we just have a process and we just use the process regardless of how it impacts folks. And so I love that there's this sort of like off ramp for like, no, this is a system problem and it's a crisis and it needs an immediate response. Let's triage it over here to our practice level. I just think that's really smart and hopefully makes things more efficient as well.
You're queuing us up for tomorrow again, Anna.
Oh, sorry. I just want to talk about
It's good. No apologies. We hope everyone in this room right now comes with us tomorrow. So we have a very, as Lucy called it, juicy data example.
All right. Well, why doesn't that group go first?
What do you say, Lucy? Go. All right,
Yeah,
I'm gonna read my notes, and Lucy, you jump in, and we're gonna actually, and I can share my screen for the what we found in the SOCAC report. So we're talking about, Lucy shared that there's been juvenile justice system leadership changes over time. There is a lot, or appears to be, or questions about the number of youth in the juvenile justice system who are part of the sex offending population. Also and this is Lane County, also in Lane is sex offending trauma in schools, concern about that. So there's questions about how many youth are involved in the juvenile justice system who are part of that sex offending population. What's the extent of sexual traumatization in the county, in the schools? How many of our providers are actually serve this population? Then we also had a couple subpopulation questions, including how many of this population are Spanish speaking, and how many of them, or I think Lucy, you said you're seeing high numbers of the LGBTQ plus population with issues and needs in the school system. So I miss any of those concerns, data points, that all the juicy data stuff that we were identifying?
No, the only thing I'd add is that a lot of the data is sort of anecdotal, coming from the Title IX coordinator at the schools, who has raised a barrier with us around this issue. And so, you know, finding like really hard data is pretty hard, but we have indicative data, or at least, you know, a sense of how big this issue is.
And we identified some opportunities to find some other data. And the anecdotal data is still good data. It's pointing to a need within your counties. So we were wanting to look at data for your under 17 population in the justice system, understanding that you're still covering up to 24. So Lucy has made some contacts with adult corrections to see if, the population within the transition age youth. There may be concerns about obtaining county level data. We talked about just looking at the juvenile justice court system. And yes, we can state that. So let's restate the issue again, and for Selby, and I think Lucy, you will say it more articulately than I will. Go ahead.
So the issue is the youth in schools with sexualized behavior that becomes problematic, and sexual trauma, as well as youth who are sexually, or are, you know, actually to the point of sexual offending, and how to work with all of those populations, and in particular around youth who are Spanish speaking as a subpopulation, and LGBTQ youth as another subpopulation. So it's kind of a large amorphous population overall, with some more, you know, sort of hard stops around actual offending. But the school Title IX coordinator estimates that around 25% of youth in their school has sexual trauma issues resulting in sexualized behavior that's problematic in the classroom.
Yeah, thank you, Lucy, for that recap. So in addition, the data that we identified that we want to go look at, and shouldn't be too difficult to find, is the adjudication data. How many youth in your juvenile justice system have been charged with sex offending offenses? And then we know the national data of the crossover youth who are both in the juvenile justice system as well as the child welfare system. Those youth tend to have high behavioral health needs. So let's also look at your child welfare population data. How many sex offense investigations are in the county? How many potential victims of sex offense do we have? To what extent did they become juvenile justice offenders as well? And then what do those numbers look like? We're all really cool. Is there a system of care data library that has links to all of those data sources? Here's some. The Oregon Child Abuse Prevalence Study is also a great source of data. Yeah. We also found the SOCAC report to be helpful. And so I'm going to try to share my screen, but it's not liking what I have up there. Pardon me for 1 minute. There we go. So on graph 1, this is the percent of 8th grade students with a safe place or person they can go to outside of the school. Speaks to their safety, speaks to their potential trauma, speaks to their possibly their victimization. And let's look at where are our lowest below the line. Who are the children that feel the least safe? You have your transgender, your gender expansive, your gay and lesbian, your bisexual, pansexual, and your queer population as well. really emphasizing the need to address this population. Okay, watch your eyes while I scroll. We're going to go to page 16 now. And this is the percent of youth who had an unmet mental health need by race, ethnicity, and also we have the gay, lesbian, straight, bisexual, pan, and queer breakout. And here we see, now this is, if it's above average, this is the youth that have the most needs are the higher bar this time. And again, the leaders by far are the same population. So it's two ways of looking at your same SOCAC data report to see both sides, or two different data points that support the need. To look at, care pathways. What are your care pathways for this population of youth? Do they have the ability to receive services through all different systems doors? We talked about schools, we talked about child welfare, we talked about juvenile justice. And Gabe had some really cool observations again about these two tables with regard to the Black African-American population and Hispanic Latino, but I do want to give the opportunity for other groups to report out or ask us questions.
I think that was great. There's only 4 minutes left, so I don't know if someone has a question or comment or a priority or conversation that you were having in a group that you wanted to share or bring to the larger group.
We talked about how data is hard, but we also demonstrated within 15 minutes what we were able to brainstorm as well. And it's the value of having partners at the table, right? Thinking about all of these different angles, different data points, different system perspectives that do make it easier. So then to your point, Selby, how do you get the partners to the table, get them interested in data, and then use their data to show that common agenda, that common shared population of focus, and common desire and need to address the needs of those populations. That's why Kim and I geek out over data in a nutshell.
The other thing I think that we've demonstrated in this conversation was that different people coming from different systems are going to ask different questions about the same problem. And so having that cross-system conversation about what data would help us figure out how to solve this problem, actually, you're going to get a really rich conversation. Even if you can't answer all the questions, understanding what the questions are can help you set the priorities and determine how do we want to set a plan. Like we were talking about residential services in Central Oregon. We may not be able to answer all of those questions, but knowing that those questions need to be answered, we can start breaking the problem up into steps.
Mm-hmm.
Absolutely. And Selby's comment in the chat box as she listens today realizes it's a secondary skill to be able to turn the data into a story or make sense of it. You can do the research, but you need to develop the storytelling skill. There I am. I'm now tongue-tied too, Kim. Anybody here, results-based accountability is understanding, using the partners to understand the story behind the curve, the story behind that data, and then identifying solutions. I could talk to you for hours, even though it's now evening on the East Coast, about results-based accountability and turning that data into stories to engage partners. Another time.
Yeah.
This has been fun.
I think that suggestion around the resource links, I think that's a great idea because you will know where the data for your state and where's easy access to them so that you can kind of go to one space. Chris.
So I have a question about our data dashboard. Who's in charge if I'm like, this isn't working maybe the way I need it to work? Sherman County has its own tab, which is great, but then my other counties that have larger populations all don't have their own tab. So I'm curious as to who's in charge of that.
Chris, that's me.
I'll just call you. That's
I'm happy to be the data go-to for all the things dashboard and not dashboard related. But the short answer is we're not going to turn that on because of the suppression rules. The population in those counties is too small.
Yeah, well, what I'm trying to understand is that's fine, but Sherman County has a teeny tiny amount, but it has its own tab. So that's what I was trying to figure out is I can Sherman County in EOCCO, which has, I don't know, maybe 7,000 people.
Oh.
Yeah, but yet like Baker and Union and Malheur, Umatilla has its own tab too. I just was curious, so that's all.
I thought it was counties with less than 50,000 people or suppressed. So
Yeah,
Yeah,
and
so let's have that conversation and see if ORA wants to look at how they set those rules up. They might have made an error somewhere.
okay.
yeah, on it. Thanks, Chris.
Chrissy, just real quick, you did put the resources by Frameworks in the chat. We also did a whole series with Frameworks when we ran SAMHSA's National Technical Assistance Center with social marketing and telling your story. So that was a good reminder, and I will send that link out, resources. We are out of time,
Yes.
but we can continue this conversation tomorrow. So there's your third or fourth plug. We hope we see you at the barriers meeting so we can talk more. Thanks for having us.
Thanks, everybody.
Thank you. Have a good night.
Bye.